Hi everyone, welcome back to the channel. In today's video, we are going to cover the most repeated complaints and regulatory questions for the CPC 2025 exam. These are the questions that comes repeatedly and knowing them will really help you score higher. So take your notebooks and note it down. Don't forget to subscribe. So let's start. What does OIG stands for? A. Office of Inspector General. B. Organization of Insurance Guidelines. C. Official Inspector Group. D. Office of Independent Governance. Answer A. Office of Inspector General. What is the main purpose of a complaints plan? A. Increase revenue. B. Prevent fraud, waste and abuse. C. Approve claims. D. Track billing productivity. Answer B. Prevent fraud, waste and abuse. When is it acceptable to disclose PHI without patient authorization? A. For marketing. B. For research. C. For treatment, payment and healthcare operations. D. To friends. Answer C. For treatment, payment and healthcare operations. Which Act established national standards for electronic healthcare transactions? A. Stark Law. B. MCHALA. C. HIPAA. D. False Claims Act. Answer HIPAA. Health Insurance Portability and Accountability Act. It establishes national standards for electronic health transactions and also it protects patient health information. And other options, Stark Law. It is a law that prohibits physicians from referring patients to facilities where they have a financial interest. It is also known as anti-self-referral law. In simply, doctors cannot refer to facilities they financially own. Okay. Then MCHALA. This law requires emergency departments to screen and stabilize anyone who comes for emergency care regardless of ability to pay. Then False Claims Act. It is a law that punishes submitting false or fraudulent claims to the government, mainly focus on Medicare or Medicaid frauds. So you can note it down in the simple points shown on the screen so you can quickly remember it. It is one of the most important questions in CPC exam in complaints and regulatory part. Okay. Next question. The False Claims Act penalizes A. Incorrect credentialing. B. Filing fraudulent claims. C. Employee misconduct. D. Coding errors that are accidental. Answer B. Filing fraudulent claims. Upcoding is an example of A. Abuse. B. Fraud. C. HIPAA violation. D. TPO exception. Answer B. Fraud. Who enforces HIPAA security role? A. CMS. B. OIG. C. OCR. D. AMA. Answer OCR. Office for Civil Rights. The Medicare program is made up of several parts. Which part is affected by CMC HCC? Part A, Part B, Part C, Part D. Correct answer, Part C. CMS HCC is a hierarchical condition categories. It is a risk adjustment system used by Medicare. It looks at a patient's diagnosis codes to understand how serious their health conditions are. So, if a patient has more chronic or complex conditions, their risk score also increases. Payment score. Understand. You can note it down in simple points so you can easily remember it. This is a frequently asked question in CPC exam. Medicare is divided into four main parts. Part A is hospital insurance. It covers inpatient hospital stays, skilled nursing facilities, and some home health services. And Part B is a medical insurance. It covers outpatient care, doctor visit, lab, x-ray, and preventive services. Part C is a Medicare Advantage. These are private plans that combine Part A and Part B and often include drug coverage. This part is directly affected by the CMS HCC risk adjustment model because Medicare pays these plans based on patient risk scores. Part D is a prescription drug coverage. It helps pay for medications and is offered through private drug plans. It requires monthly premium. If you have any doubts or questions about this topic, just comment below. I will make sure to explain them for you. Okay. Which law prohibits physician from self-referring to facilities they financially own? A. HIPAA, B. Stark Law, C. MCHALA, D. False Claims Act. Answer B. Stark Law. So that's all for today. Comment what topic you want next. I will make it for you. Don't forget to subscribe, like, and share.